Hi Gary, I'm Victoria. I'm a student nurse practitioner. I'm going to be assessing you today. How would you like to be addressed?
Gary's fine.
Okay, and then what brings you in, Gary?
He's got a slight earache.
Okay, and then we did take Gary's vital signs and they're all within normal limits except his fever, his temperature was elevated. He has a fever at 102 degrees. So Gary, when did this first start, your earache?
About 4 days ago.
And where is it located?
It's kind of in and around the ear here.
And then how long have you had it for duration? Has it been just 4 days or have you had it in the past, recently?
Just recently here, the last 4 days.
Okay, and then how would you describe the ear pain?
It's kind of like a dull ache.
And anything that makes it worse?
It's pretty constant.
Okay. Anything that makes it feel better? And then have you noticed it more throughout the day, like where it might hurt worse than other times?
No, it's just kind of a constant ache.
Okay, and then how would you rate it from 0 to 10, 10 being the worst?
Probably like between a 4 and 5.
Okay, and then I'll ask you a couple more questions. Have you had any illnesses recently? Okay, any shortness of breath?
Nope.
Any chills that you might have felt or experienced? Any abnormal sweating? Okay. Do you have allergies to anything?
No.
Okay. And then what medications are you taking? Are you on any medications?
Not currently, no.
Okay. Any vitamins, supplements, nothing over the counter?
Nope.
Okay. And then have you ever had earaches in the past?
Not that I'm aware of.
Okay. Any medical history that we need to be aware of for you? Have you had any like diabetes, any heart problems, any blood disorders, conditions that you might have?
Nope.
Okay. Any surgeries that you've had in the past?
Not really, no.
Okay. Any like wisdom teeth removal or like appendix removed, anything like that?
Wisdom teeth in the past, I guess.
Okay. When did you have your wisdom teeth removed?
Like 6, 7 years ago.
Okay. And then for your family, any family history that we need to be aware of? Have they had any ear issues or like diabetes, heart problems? No, nothing for them. And then for your social history, do you smoke? Any tobacco products that you use? Any alcohol? If you drink alcohol, how much alcohol do you have like a week?
Just kind of occasionally, probably like twice a week.
Okay. And then when you drink, how many drinks do you have
Just
at
like
each time?
1 or 2 glasses.
Of?
Just like a scotch or something.
Okay. And then let's see. Are you around anyone else that might smoke? Okay. And then do you own any pets?
Just a dog.
Okay. Any allergies that you've had concerns with, like animals or seasonal allergies, anything like that? Nope. All good with that? Okay. And then do you feel like you live in a safe neighborhood? Any concerns where you live at? Any like dust concerns around there? Nope. Okay. And then let's see. I'm just gonna go ahead and assess you, okay? I'm gonna go over here. And then you're good where you're sitting. I'm just gonna look at your ear symmetry. Looks very symmetrical. I'm gonna feel here, and then does it hurt anywhere? Here? Is it more tender on like your left side?
Yeah.
Okay. Sorry, I know it hurts as I'm touching. And then I'm gonna go ahead and get my otoscope. And then what I'm gonna do is I'm gonna check both of your ears. I'm gonna start with your good ear first. And then I did already put on the correct probe here that fits for his ear. So what I'm gonna go ahead and is look in your ear, and I'm going to pull it up like that. The ears look pretty clear. Cone of light is at 5 o'clock. Looks pretty good. I'm gonna go ahead and sorry, I know this ear is tender, but I'm gonna pull it back here. Okay, so I can't see any cone of light because of the redness. The external canal is clear, no redness, but the middle portion, the tympanic membrane is red and bulging, and it does look inflamed. So that could indicate that you have some what it's called acute otitis, media otitis, and that basically means ear infection. So it looks like you have some on your left side. So what I'm going to do is I'm just going to do a couple more tests to make sure like your hearing is okay, all right? So, oops, my computer went dark. What I'm gonna do is I'm gonna actually, are you able to kind of face that way? And I'm gonna do kind of hearing test and have you repeat a couple things for me.
Okay.
So I'll have you kind of like lean and look that way, kind of like how I'm sitting. Is that okay for you? Alrighty, so I'm gonna first have you cover your left ear, and then I'm gonna say a couple things. So 8, and then just repeat after me.
8.
8.
8.
Perfect, and then we'll do the other side. So do the same thing. 3.
3.
7.
7.
Perfect. Alrighty. So you can go ahead and sit back normally. So he is fine with the whisper test, no issues there. So what we're gonna do next is we're gonna perform a Weber test. And what that test is kind of like for unilateral hearing loss, and then we'll do a Rhine test, and that kind of tests for like your air and bone conduction to make sure you don't have any hearing loss. You did good with the first test, but just want to make sure that it's all right for that. And then what I'm gonna go ahead and do is tap this and just tell me if you can hear this equally in both ears. Perfect. And then what I'm gonna do here is I'm gonna do the same thing. I'm gonna tap and I'm gonna first put it on your bone, kind of behind your ear for here. And then after that, I'm gonna put it here and kind of just tell me like when you stop hearing it, just say stop, okay?
Okay.
So I'm gonna do it here, just let me know. Oh, sorry, let me try that one more time. There we go.
Okay.
And let me know again when you stop hearing it.
Okay.
Perfect. And I'll do the same thing on this side.
Okay. Okay.
Perfect. Alrighty, so that is normal as well. So that's really good. And then let's see, I'm gonna go ahead and listen to your heart and your lungs, okay? Just to make sure that's okay, I wanna make sure your lungs don't have anything else going on with them, even though you don't have a cough or shortness of breath. And then I just wanna assess your heart to make sure that's okay. So normally what I would do is I would have him take off his shirt and I would listen to the heart and lungs underneath that just to hear better, but for now we'll just go ahead and test it how it is right now. And I'll just have you take a deep breath. Oh, you're good. And again. Again. And again. Very good. And I'm just going to have you lean forward and I'm going to do the same thing. Again. And again. Very good. Again. And one more time. Very good. And then you can go ahead and lean back and I'm just going to listen to your heart. Okay, here at S1 and S2, no murmurs, no friction rub, no concerns with the heart, and then lungs are clear to all areas, and I don't hear any wheezing, any fluid buildup, so that's really good. So with your diagnosis, of the ear infection that you have, what I'm going to do is I'm going to go ahead and prescribe you some amoxicillin, just like a 500 milligram tablet that you'll take twice a day orally, just in my mouth. And just, if you want to, you can take it with food to not upset your stomach, but either way is fine. But make sure like when your earache is starting to feel better, you continue taking the antibiotic, just because even though you're feeling better, you still have to get that bacteria killed all the way. And then for the pain, you can take just some Tylenol or ibuprofen over the counter and kind of just follow bottle instructions for that. So that should help with your pain, okay? And then do you have any other questions for me? Perfect. Well, it was nice meeting you, Gary. Thank you.
Yeah,